Wash my hands, close the door for privacy. Hi, my name is Sarah. I'm going to be your nurse for today. How are you? Good. Okay, can you state your name and date of birth for me, please? I'm just going to verify. Peterson. Okay, so my MAR shows different birthday than what the patient's wristband says, so I'm just going to swap those out. And I'm going to verify again. Can you state your name and date of birth for me? Wallace Peterson, date of birth 6645. Okay. Do you have any allergies, Mr. Peterson? None? Okay. The patient is not wearing an allergy band. I'm going to verify the MR number, 721-4732, 721-4732. Okay. So, Mr. Peterson, I'm here to do a full head-to-toe assessment on you today. I'm going to start off with some vital signs. Temperature, 100.6. I have blood pressure at 162/79. Heart rate is 93. Respirations are 28. And I have O2 sats at 90% on 2 liters nasal cannula. I do have an order to maintain your O2 sats above 92%. So I'm just going to titrate the oxygen until his O2 reaches 92%. Okay. Are you in any pain today, Mr. Peterson? You said 3 out of 10? Okay. And where is that pain? Your lungs? Does it radiate anywhere? No? Okay. What makes it worse? Coughing? Okay. And what makes it better? Not coughing? Okay. And then can you describe that pain for me? Said it's an ache? Okay. Do you know where you are today? Fortis Hospital? Okay. Do you know why you're here? Okay. And do you know what date it is today? Okay. So I'm just going to shine this in your eyes. Okay, and follow the pen for me. Okay, pupils are equal round and reactive to light, and they are also able to accommodate. Oral mucosa is pink, moist, and intact. I'm going to check the skin turgor. Okay, skin turgor is non-tenting. Mr. Peterson, have you had a cough? Yes? Okay, is it productive or non-productive? Productive? Okay, and what's the color of that sputum? Yellow. And the consistency? You said thick? Okay. And then about how much, if you could fill up a little medicine cup? About 15 milliliters? Okay. I'm gonna inspect the thorax. Chest expansion is rising symmetrically. I'm gonna listen to 8 places on the front as well as 10 places on the back. Okay, so respirations are deep and labored, and they're also irregular. Lung sounds, hearing some crackles in the lower lobes of the lungs. I would listen to 10 places on the back and find the same findings as well. Okay. Assess heart sounds. Starting with the second intercostal space to the right, the aortic. S1, S2. Second intercostal space to the left, the pulmonic. S1, S2. Third intercostal space to the left is Erb's point. S1, S2. Fourth intercostal space to the left is tricuspid. S1, S2. Fifth intercostal space, mid-clavicular line, is the mitral. S1, S2. And I'm going to listen for a full minute. Okay, I have the apical pulse as 93 and regular. Okay. I am going to assess the pulses, starting with the brachial pulse. Going to check both sides for symmetry. Okay, +2 and regular, radial, +2 and regular, both sides. I'm going to check for capillary refill. Less than 3 seconds on both sides. Can you squeeze my hands for me? Okay, and push down and pull up. Okay, and I have a strength of +5 equal bilaterally. Mr. Peterson, when was your last bowel movement? Today? Okay, what was the color of that? Brown? Okay, did it have any unusual odors? You said it was smelly? Okay, and the consistency, was it soft, was it hard, was it watery? It's hard? Okay, and about how much? Small? Okay. All right, I'm gonna assess the abdomen. The abdomen is flat. It's non-distended. Gonna listen to 4 quadrants, starting with the lower right quadrant. Lower right quadrant, vowel sounds active. Upper right quadrant, vowel sounds active. Upper left quadrant, vowel sounds are active. Lower left quadrant, vowel sounds are active. Okay, I'm gonna palpate, and can you tell me if you have any pain or tenderness? Starting with the lower right quadrant, no. Upper right quadrant, no. Upper left quadrant, no. And lower left quadrant, no. Okay, so no pain or tenderness noted when palpating. Okay, I'm gonna come back and I'm gonna assess your IV site. Your IV is, your dressing's clean, dry, and intact. There's no redness, swelling, or infiltration, and it is dated for today. I would go ahead and flush and check for patency. Okay. Mr. Peterson, when was the last time that you've urinated, voided? Okay, doesn't say. What color was that? Yellow. Was there any unusual odor? No odor? Okay. And the clarity, was it clear? Was it cloudy? It's clear? Okay. And then about how much? 150 milliliters? Okay. Did you have any pain? No? Okay. Did you have any urgency? A little bit? Okay. And any change in frequency? No? Okay. Okay, I'm just going to assess your genitalia, so I'm going to pull this up. There are no lesions, edema, abnormalities, discharge, or any sores. I'll put that back down. Okay, I'm going to go down to the lower extremity. I'm going to assess for edema. There's no edema on this patient. So I'm going to check bilaterally. There is none. Okay, so I'm going to wash my hands and put on some gloves before I touch the feet. That can fit. Okay, I'm going to assess the pulses on both sides. So I'm going to start with the dorsalis pedis pulse. +2 regular on both sides, posterior tibialis. +2 regular on both sides. I'm going to check capillary refill and compare. It is less than 3 seconds on both sides. Can you push down for me? And then pull up. Okay. And strength on the lower, bilateral lower extremities are a +5. I'm going to wash my hands. and I'm gonna assess the overall skin. So skin is warm, dry, and intact. The color is appropriate to ethnicity. There's no presence of breakdown on the skin or any other abnormalities. Okay, Mr. Peterson, we are all done for today. I'm gonna put your bed down and your rails up for your safety. Is there anything else I can get you? No? Okay. So here is your call bell. If you need anything, just let me know. I'm gonna wash my hands and I'm gonna open up the door.